Good morning. I'm Danielle Van Dam, the Chair of the Conference Planning Committee. Do you mind please taking your seats so we can get started? Welcome to Pittsburgh and our 47th National Conference on Pediatric Healthcare. We're also celebrating PNP Week, and everyone on the Executive Board, the Conference Planning Committee, speakers, volunteers, and staff are all absolutely delighted to have you with us. Our conference agenda has been carefully crafted to give you the best of both worlds. You can participate in engaging sessions and still have time to visit the exhibit hall to discover the latest products and services. You don't have to choose. Please join us in the exhibit hall immediately after this session and again at 6 to 7:30 tonight for our attendee welcome reception. If you're traveling on your own this year, grab a flying solo ribbon from our ribbon board and look for others wearing the ribbon to make new connections. Be sure to check out our mobile app or program book for the exhibit hall hours through Friday. And don't forget to enjoy coffee in the exhibit hall from 8:30 to 9:30 a.m. on Thursday morning and a continental breakfast with our exhibitors from 8:30 to 9:30 on Friday morning. They truly value your interest, and with their support, we're able to create an amazing conference experience for everyone. Grab a passport to prizes in the exhibit hall and have it handy when you visit the exhibitors over the next few days. You could win fabulous prizes come Friday. If you haven't had the chance yet, we encourage you to download our NAPNAP conference app. It's a very useful tool with session itinerary, maps, key information, and real-time updates. We're happy to offer complimentary Wi-Fi, and instructions to claim your CE are printed on the ticket with your name printed on the name badge of your ticket. NAPNAP's conference offers a wonderful chance to connect in person. Take a break and enjoy free afternoon snacks while you chat with colleagues and learn more about our shared interest groups. Networking breaks are available from today through Friday. Each day, we will introduce a new set of SIGs for you to explore. Today's break is sponsored by St. Jude Children's Research Hospital. Now we'd like all attendees who have served in the armed forces to please stand. Thank you for your service. Now will everyone please rise for our national anthem.
Good morning.
Good morning.
Good morning, yes. I'm James Wendorf. I'm CEO of NAPNAP. And this morning it's my pleasure to also serve as the CEO of Thank Yous. And I'd like you to join with me in thanking a lot of folks who are making this conference happen. First thank yous to Drs. Danielle Van Dam and Teresa Whitehead, the chairs of the Conference Planning Committee. We wouldn't be here without them and the committee, so thank you. staff at NAPNAP, and our conference team is led this year, as for the past many years, by Laura Nelson. So please thank Laura and the whole conference team. About 15 people who are here making this happen. Thank you. And they're here bringing their creativity, their dedication, their discipline, making NAPNAP's mission really come to life at an event like this, to optimize child health and well-being and to empower our community of pediatric experts. That is you, so welcome. Our executive board members set direction for NAPNAP, as you know, on behalf of our 7,500 members, and it's my privilege to work closely with them, and I want to acknowledge their commitment and leadership. Dr. Nutrina Tate, our president-elect, Dr. Daniel Crawford, our immediate past president, Dr. Danny Sevens, our treasurer, Ms. Cassandra Newell, our secretary, our members at large, Ms. Shanoa Dale, Dr. Jeremy Jordan, Dr. Kelly Keith Marcoux, Dr. Bridget Van Graffelen, and Dr. Chelsea Woosley. And we're truly grateful to have our president, Dr. Felicia Bowen, leading NAPNAP at this time with her expertise, her passion, and her dedication to children's health and well-being. So please join me in thanking all of our leaders this time. Thank you. Partnerships are key to our success, and we have many of them, and I want to acknowledge some of the most important, especially those that are part of this conference. We have a number of partnerships with leading child health organizations. We have guests here from the American Academy of Pediatrics, the Association of Faculties of Pediatric Nurse Practitioners, the National Student Nurses Association, and the Pediatric Nursing Certification Board. Please join me in welcoming them, and please engage with them through the conference. A special shout out to our colleagues from NAPNAP's charitable organizations. We have two. We have the NAPNAP Foundation, as you know, as well as NAPNAP Partners for Vulnerable Youth. And these two organizations, each in their own way, provide vital support and education to NAPNAP members and beyond. Both charities have a strong history of sponsoring education programs, including 3 sessions each at this conference. And the foundation has also brought 5 members here on scholarships to attend. The impact of the foundation and NAPNAP Partners is made possible by donors like you. That's why we created the Impact Fund. You'll find a card with a QR code on your seat. You can use it to scan the code and donate to the Impact Fund, or also you can participate in the foundation's silent auction, which is going on. I myself am proud to be a donor to the Impact Fund, and I invite you to join me. If everyone in the room pulls out their phones and donates at least $20, $25, we could raise more than $10,000 in the next few minutes. How many people would that mean could come to conference next year who wouldn't otherwise be able to do so? So please consider that. I'd like to also welcome and acknowledge the premier sponsors for this conference and for all of 2026, and that's CeraVe and La Roche-Posay, who also have probably the most popular booth at the exhibit hall. we're very grateful for their ongoing support of NAPNAP and also our chapters. And last year alone, in 2025, Sarah B. was able to hold events, 35 events across the country, working with our chapters. Many of you participated in those, and we deeply appreciate all they do over the course of the year. We have a number of conference sponsors, and those are will be up behind me. They play a crucial role in making this event happen. And when you visit the exhibit booth, please stop by and let them know, please, how much you appreciate what they do in supporting NAPNAP. We have 15 corporate circle members who provide support throughout the year, and they allowed us to deliver a wide variety of resources to our members and their patients. So please join me in thanking all of our sponsors and joining me in a round of applause for them. Thank you. And now it's my pleasure to welcome to the stage NAPNAP President, Dr. Felicia Bowen.
Are there any pediatric nurse practitioners in here? All right. Good morning, NAPNAP. Let's get fired up. Welcome to Pittsburgh, the Steel City, and welcome to a gathering of some of the most strongest, most resilient, most principled professionals in healthcare today. That's you, NAPNAP. Give it up. When we chose Pittsburgh as our conference site, I knew I wanted to talk about steel. Not because it's the Steel City, but because when I think about steel, I think about pediatric nurse practitioners. Providers who care for children embody the qualities of steel. Steel is known first for its strength, its resilience, its resistance to deformation. It doesn't fracture. You can push it, you can stress it, you can test it, and it won't break. That's us, folks. We will not be broken. We are professionals built on moral strength. We possess the strength to speak the truths in systems that don't always want to hear the truth. We possess the strength to stand firm in our principles when the stakes are high. We possess the strength to hold the weight of families who care for sick children. Just like steel forms the backbone of a skyscraper, pediatric nurse practitioners form the spine of pediatric healthcare in this country. Steel has ductility and malleability, the ability to be stretched, bend, formed under pressure, all without fracturing. Under the toughest conditions like overcrowded healthcare systems, caring for children with complex medical conditions, caring for the families, we might bend, but we don't break. Instead, we adapt and we innovate. That's what nurse practitioners do. We show up day after day, and we do what it takes to honor and care for every single child entrusted to us. And we do this regardless of who they are, the color of their skin, where they come from, the gender they identify with. That is the heart of pediatric nursing. That is the steel in our spine. Steel is also known for hardness and toughness, its ability to withstand trauma without shattering. Nurses live this truth every day. We saw the power of that toughness in our colleague. I believe Alex Preddy's courage and determination to stand up for what was right in the midst of conflict, it's uncertain and uncertainty, it cost him his life. And I believe Alex's sacrifice is etched into the steel of our profession. We honor Alex every time we refuse to be silent in the face of injustice, particularly when it pertains to children. Another remarkable property of steel, especially stainless steel, is that it doesn't corrode. For more than 25 years, nurses have been the most trusted profession in this country. Why? Because we don't corrode. We hold fast to our code of ethics. And finally, steel is an exceptional conductor. It channels heat and electricity. And like steel, nurses conduct energy. We move advocacy forward. We transmit hope. We catalyze change. And let me tell you, this past year, no secret, has been a challenge and has required every ounce of our energy. Advanced practice nursing has been under attack, it seems like, enormous pressure. We've seen threats to Title VII and Title VIII that fund nursing education and workforce. We've witnessed the Department of Education refuse to acknowledge nursing as a professional degree. This has caused jeopardizing of access to funds that our students need to be able to enter the profession. And as many of you know far too well, pediatric healthcare providers in this country are among the lowest paid specialty. These realities aren't inconveniences, they're direct threats to our workforce, to our talent pool. Because when we can't afford to graduate, when we can't afford graduate education, when people can choose another specialty where they know, they're going to get more, they're going to get higher pay, that's a threat to us. They may want to care for children, but it's about the Benjamins. When we struggle with structural barriers that become higher, we will struggle to attract the next generation of pediatric nurse providers. And this means children who are among the most vulnerable in this country, some of them will struggle to access care. That's why advocacy is not an option. It's a professional obligation, folks. Provision 9.5 of the ANA Code of Ethics mandates that nurses engage politically. We must engage politically, it says, to protect public health and confront the social and structural forces that shape children's lives. Now, I'm going to say that dirty P word, politics. I'm not afraid of politics, folks, and you shouldn't be either. Politics and policy are not mutually exclusive. You see, politics is about how to gain power. That's that focus. But policy is what you do when you have that power. This is important because when policy hurts children, silence is not neutrality. Silence is complicity. And there is no room for complicity when it comes to caring for children. I began my presidency pregnancy on the 1st of July, 2025. And on the 4th of July, 2025, HR 1 was passed. And since then, it's been skates on for pediatric organizations. We have issued calls to action. We have engaged Congress. We've signed on to coalition letters. We've submitted comments and filed amicus briefs. We've done this day after day. We strive to show up in every room, at every table where decisions are being made about children's health. And we continue to show up, but we can't do this work alone. Your voice as a pediatric provider is invaluable. You're a constituent. And as a community member, as a community leader, as a provider, and as a pediatric expert, your voice matters. Be the voice for the patients you serve. They don't have a voice. And I don't mean the crying and screaming, right? They don't have a political voice. You be that voice. Share the stories. Share the stories with the people who matter. Tell them about your patients. Tell them about your ability to care for them or the barriers that you face while trying to care for them. They need to hear those stories. Raise your voice when the moment comes, because children need more than our clinical expertise. They need our advocacy, and they need our courage. Now, even as we face these pressures, NAPNAP is looking forward. We're building upward. And I'm proud to share that we are exploring the feasibility of a NAPNAP Fellows program. We want to do this because we want to recognize the extraordinary expertise and contributions of the members in this room. We've got some fabulous folks here. We really do. So yes, give it up for yourselves. I've asked Dr. Neutrina Tate, our president-elect, to lead a task force to investigate what it would take to develop a fellowship. And my hope is that at our 2027 meeting, we will inaugurate our inaugural cohort of NAPNAP Fellows. So, be on the watch. Please, if you get surveys or questionnaires, respond to them because we need to hear from you. When I stood before you 2 years ago, I talked about NAPNAP becoming a global source of pediatric education and excellence. And I'm happy to report today that under the leadership of Dr. Mary Dirks and through our partnership with True Merit, our NAPNAP Global Initiative is boldly moving forward. We're preparing to launch this summer our Pediatric Nursing Academy. It's a global effort. More than 45 pediatric nurse leaders from around the world are working together to shape this work. And we will be issuing NAPNAP's first pediatric nursing micro-credential. That is something huge. If you want to be involved in any of these efforts, contact us, let us know. And so to each of you, my NAPNAP family, I want to thank you. Thank you for the steel that you bring to our profession and to this organization. Thank you for your strength, your resilience, your conductivity, your innovation, and your courage that you bring to nursing each and every day. You are the structural support that this organization needs. And together, when we stand together, we are stronger than we could ever be. NAPNAP isn't going to fracture. Not today, not tomorrow, not ever. So with that, I welcome you to Pittsburgh, the Steel City, and to our 47th annual conference, that is sure to energize, strengthen, and unite us all. Thank you for all that you do. Today marks the start of NAPNAP's national election. It's your opportunity to have a voice and choose our next leaders. Our organization thrives when leadership represents all members. And the only way that happens is if you vote. So please vote. You'll hear from President-elect candidates in a few moments. But first, I want to introduce the entire slate of candidates. For President-elect, there's Danny Sevens, Dr. Danny Sevens, and Dr. Chelsea Woosley. Dr. Kathleen Fabian, and Dr. Michael Maney. For member at large, Dr. Cherry Frederick, Dr. Mary Gallagher, Dr. Kelly Keith Marcoux, Dr. Victoria Keaton, Dr. Lori Robinson, and Ms. Shanice Williams. For the nominations committee members, we have Dr. Diana Hines and Ms. Tricia Williams. So let's give a big round of applause to these folks. We appreciate your dedication to serving. It's a lot to put yourself out there. So thank you. Additionally, we want to have a big shout out and thanks to our nomination committee led by our past president, Dr. Dan Crawford. Now I'd like to welcome first our first president-elect candidate, Dr. Danny Sevens.
Hi everybody. I'm so excited to be up here. Instead of making a New Year's resolution this year, I was challenged to come up with a term or a phrase to sort of accentuate the 2026 year, and I came up with reflection. And as I've been working through this process of reflecting on my life and my career, I started to reflect on why does NAPNAP mean so much to me? Why does this organization impact me so much, and why am I so committed and devoted to it? And I just wanted to share a little bit of a story. This isn't just personal, but professional. Did you know that Pittsburgh is made up of 90 different small communities and neighborhoods? And I grew up just 11 miles southeast of here. So that's why I'm wearing black and gold. What defines this region isn't just the geography, it's the community, it's the belonging, it's the teamwork, and it's the neighbors that show up for one another. And I think that spirit is captured perfectly in the Pittsburgh's most beloved tradition, which is the cookie table. If you're not aware of the cookie table, I'm going to give you a really short story. During difficult financial times, couples were having a hard time affording a wedding cake. And so the neighbors and the aunties and the friends all baked dozens and dozens of cookies so that the couple would have something sweet to share with their guests on their wedding day. Today, that still is true. Couples have aunties and neighbors and loved ones who all bake cookies. And often those cookies are next to a wedding cake, but they're still at every wedding, not just in the Pittsburgh area, but all across the country and around the world. Out of hardship came tradition. What began as a practical solution became a treasured symbol of generosity and community. And today, wedding celebrations continue to overflow with cookies, which you'll see at the sugar social tonight. No matter what the venue or the denomination, there's always at least one of these tables that shows that sense of community. And to me, NAPNAP's mission is similar to that Pittsburgh cookie table. When we face challenges in healthcare, in our practices, in policies, and in certain times, we don't step back. We bring our best. We bring our expertise, our ideas, our mentorship, our research, and our advocacy. We show up for one another. We show up for the children. And together we build solutions. Together we build something lasting. NAPNAP has been a place of belonging for me, and it's felt like home, a place place where I'm supported and challenged and inspired, a place where neighbors become colleagues and colleagues become friends. It would be the honor of my career to serve as your president-elect. I humbly ask for your vote and for the opportunity to continue building together the kind of community that always shows up with something to share. Thank you.
Thank you, Dr. Sevens. Now we'd like to hear from candidate number 2, Dr. Chelsea Woosley.
Hi everyone, I'm Maria Woosley and I'm not nervous. I am a dual certified pediatric nurse practitioner for over 22 years, and I've worked in a level 1 trauma center in San Antonio, Texas. And since I've been a nurse practitioner, I've been involved in NAPNAP. At the local level, I've been a chapter president, membership chair. I chaired the committee that held our inaugural conference in San Antonio in 2017. And on the national level, I've been fortunate to be a member at large. It's been an amazing process for me. This is my 4th year, and my last year as a member at large. And I've worked with chapters and SIGs and helped with membership growth and retention and membership. So I know this organization, and now I'm asking for the opportunity to lead it. I am running for president-elect because I believe in this organization. I am passionate about our work, and I know that the role of the pediatric nurse practitioner has never been more important than it is right now. Pediatric healthcare is currently shaped by misinformation, policy gaps, and a public that is increasingly uncertain about who to trust. This is our time. PNPs are uniquely positioned to change that, but only if we are organized, visible, and heard, which this group definitely is. The strength of what we do clinically must be matched by the strength of our professional voice, and I want to help us be that voice, even though mine is shaky right now. We are seeing this work now as organizations band together and fight misinformation. We've had a lot turned down on Monday, just this past Monday, from the work of the AAP and 5 other organizations, and NAPNAP should be right there at the front and center of that. We need to be in the room making those decisions too. Okay, families deserve a trusted source. I have spent years at the bedside of critically ill children, and I have seen firsthand what happens when evidence-based guidance is absent or ignored. Whether the question is about vaccine safety, or RSV prevention, or pediatric brain injury, I want NAPNAP and I want pediatric nurse practitioners to be the professionals that families, policymakers, and the media turn to for answers grounded in science and research. I am committing to 2 clear priorities. First, strengthen the NAPNAP membership and community. A thriving association requires practitioners who feel connected, supported, and invested. I will work deeply to deepen the value of NAPNAP membership at every level, from the newest grad to the most seasoned practitioner. Second, to increase NP representation in policy. We cannot afford to be absent from the conversations that shape our scope of practice, our patients' access to care, and the future of this profession. We need to be in the room where decisions are made. So I am #advocating for kids and #empowering pediatric nurse practitioners. It is our time to shine, folks, and I would be honored to serve as your next NAPNAP president-elect. Thank you.
Thank you, Chelsea. Many of our candidates are proudly wearing their I'm a Candidate ribbon. So I invite you to take a few moments when you see them, walk up to them, talk to them, speak with them, ask them some questions, ask them hard questions, okay? Voting will end on April 15th at 11:50 p.m. or 11:59 p.m., right? Like when all of our papers were due for some reason, Eastern time. You'll get an email from an independent election company, and it's going to be sent to everyone. So check your inbox, check your spam box, check your junk box, okay? Don't pass up the opportunity to vote. You decide who leads this organization. So now I'm excited to honor distinguished NAPNAP and healthcare community members with awards. Our first award is the Grassroots Advocacy Award. There we go. This award recognizes a member of NAPNAP who has demonstrated sustained advocacy in the area of child health policy or professional nursing practice issues for pediatric-focused APRNs. This year, we're thrilled to recognize Dr. Robin Lau. To be with us today, but I'd like to share with you a little bit about her. Dr. Lau successfully led the passage of California Senate Bill 68, the AD Act, the first law in the nation requiring chain restaurants to label the top 9 allergens on menus, transforming long-standing safety gaps into a landmark policy. She built and mobilized an unprecedented grassroots coalition, securing the support of over 600 medical professionals, more than 900 individual supporters, and over 70 organizations, demonstrating exceptional nurse-led leadership and statewide impact. Despite entering the legislative arena with limited prior experience, she navigated complex political opposition, built strong relationships with lawmakers, and persisted through significant resistance to ensure the bill's successful passage. Robin empowered families and even elementary school students to participate in advocacy, organizing classroom-led testimony and Capitol Hill engagement that humanized the issue and amplified the voices of children affected by food allergies. Her efforts resulted in meaningful, lasting change that will improve safety for millions of children in California and adults with food allergies, while elevating the visibility and policy influence of pediatric nurse practitioners. The new California law has already sparked similar bills in other states across the country. Dr. Lau is unable again to be with us this morning, but we will send her plaque to recognize her tremendous work. Our next award is the NAPNAP Daisy Nurse Leader Award. The Daisy Foundation was established in 1999 by members of the family of Patrick Barnes. Patrick was 33 years old when he died of complications of the autoimmune disease, ITP. DAISY is an acronym for Diseases Attacking the Immune System. As they brainstormed what the DAISY Foundation would do, they kept coming back to the one positive thing they held on to during Pat's 8-week illness: the extraordinary care that he received, the extraordinary care that the nurses provided. So Pat's family created the DAISY Award for Extraordinary Nurses. What started as a thank you from their family to nurses has grown into a meaningful and very coveted recognition program embraced by thousands of healthcare organizations worldwide. Our NAPNAP DAISY Leader Award is, it goes to Dr. Rebecca Carson. Madam Caller, thank you. Dr. Becky Carson is a visionary pediatric leader whose career is defined by authenticity, scholarship, and strong commitment to health equity. Her leadership reflects the Daisy Nurse Leader values because she guides with clarity, compassion, and conviction while fostering healthy work environments, inspiring collaboration, and advancing pediatric care through innovative methods. As the chair of NAPNAP's National Pulse Committee and co-leader of the Everybody's Work project, she has transformed the landscape of pediatric nursing by confronting systemic racism and centering inclusion in clinical practice. Her national impact is further amplified by her innovative scholarship, including over a dozen peer-reviewed publications and the creation of the Peds NP podcast, which bridges the gap between academia and real-world care. A true servant leader, Dr. Carson combines rigorous evidence-based practice with a compassionate roll-up-your-sleeves mentorship style. For all these reasons, we are honored to present Dr. Becky Carson with the 2026 NAPNAP Daisy Nurse Leader Award. Finally, I have the honor of presenting the Loretta C. Ford Distinguished Nurse Practitioner Award. Since 1980, we have recognized Loretta Ford's profound impact by making this award NAPNAP's highest honor. This award recognizes a NAPNAP member for outstanding contributions to the expansion or improvement of health. This year, the Loretta Ford Distinguished Nurse Practitioner Award goes to Dr. Jennifer Sani. Dr. Jennifer Sani is a passionate leader, scholar, and advocate whose inspiring contributions have transformed pediatric advanced practice nursing as NAPNAP's President-elect, President, and immediate past President from 2021 to 2024. She confidently led the organization through the extraordinary challenges of the COVID-19 pandemic with clarity, compassion, and courage. And her leadership was highlighted by the creation of NAPNAP Cares, an innovative mental health initiative that has trained more than 1,700 clinicians to address the national pediatric behavioral health crisis. Besides her organizational work, Dr. Sani has successfully connected clinical practice and national policy, including testifying before the FDA and the CDC in support of the RSV prevention, helping to shape the Vaccine for Children's program. As a renowned nurse scientist and the Joanne Montgomery Endowed Professor at the University of Washington, Dr. Sani has transformed chronic illness management through her common sense model of parent-child shared regulation. This internationally adopted framework emphasizes the child's voice in care and underpins her innovative work in digital health, including the development of the Impact Asthma Management app, wearable technology. Her extensive scholarship, recognized by multiple Article of the Year awards and induction into the International Academy of Nursing Editors Hall of Fame, reflects her dedication to advancing the profession. Through her work on the NOF National Task Force, she's actively involved in updating national competency standards to prepare the next generation of PNPs for an evolving healthcare landscape. Dr. Sani's career exemplifies the legacy of Dr. Loretta Ford through a distinctive blend of evidence-based innovation, tireless advocacy for health equity, and unwavering dedication to the well-being of children and families worldwide. I am proud to present Dr. Jennifer Sani with the Loretta C. Ford Distinguished Nurse Practitioner Award. Congratulations again to our award recipients. Now, it's my pleasure to introduce this morning's keynote speaker, Mr. Terry Foster. Terry Foster brings nearly 5 decades of frontline emergency and critical care experience, combined with the rare ability to educate, energize, and genuinely entertain healthcare workers. His